Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's episode is going to be a fun one, folks, but as always, it will also have some serious undertones. I'm sure most of you know John Oliver. He's the host of HBO's hit show Last Week Tonight with John Oliver, which just won again for Outstanding Variety Talk Series at last week's Primetime Emmy Awards, the show's 26th Emmy in about 8 years. Now, you're probably wondering, wait, you're a doctor. Why are you talking about a British comedian turned television host who does voices for the Smurfs movie? Stay tuned, and I'll tell you. First, my disclaimer to any diehard John Oliver fan or to the staff of Last Week Tonight, if they're watching, I don't plan on disparaging Mr. Oliver. Au contraire. In fact, I believe Oliver and his writing and research teams deserve high praise for their coverage of several complex medical topics, specifically regarding substance use. As most of you know, I am an internal medicine doctor who specializes in addiction medicine. In past episodes of my show, as well as in several Forbes articles, I have been critical about the way media and Hollywood portray people who use drugs. So imagine my pleasant surprise when I watched John Oliver's in-depth, nuanced, and data-driven coverage of topics like tobacco, drug policies, pharma, and harm reduction. Let's start with opioids. I'm sure you all remember that before the COVID-19 pandemic, we were dealing with the opioid epidemic. When SARS-CoV-2 spread like wildfire, prompting public health officials to impose isolation and lockdown measures that abruptly ended social interaction, well, surprise, surprise, drug use increased, and by a large margin. In fact, over 107,000 people died of a drug overdose in 2021, according to the CDC. And the number of overdose deaths has quadrupled since 1999. Oliver's team covered opioids not once, not twice, but 3 times. In the first opioid episode, which aired October 2016, Oliver accurately described the undertreatment of pain by the medical community and the exploitation of physicians' gaps in knowledge of pain management by a certain pharmaceutical company, Purdue Pharma. Watch this clip.
Okay. First, of course babies feel pain. How the f*** did we ever think otherwise? But more importantly, the fact that painkillers are addictive was not a myth. It's like a book of Greek mythology featuring the stories of Zeus, Sisyphus, Oedipus, and Yanni. Come on! That last one is very real and it cannot be dismissed. And look, a nuanced discussion between the medical community about the complexities of pain treatment is clearly important. The problem is, that discussion became dominated by the pharmaceutical industry, who started amplifying the message that opioids should not just be used for acute pain, like that from cancer or surgery, but for all sorts of pain, like arthritis and backaches, which makes sense as a motive coming from the pharma industry. End-of-life pain care is a narrow business. It's hard to make a lot of money off of a product exclusively marketed to people who are close to death. Honestly, I don't know how Fox News even does it. I have no idea. It's a mystery. Volume, I guess, but I don't know. And within the pharma industry, the loudest voice was Purdue. In 1996, they released the blockbuster drug OxyContin.
Then, 2.5 years later, Last Week Tonight covered opioids again because they recognized that the, quote, epidemic is very much ongoing, end quote. Oliver's team dug deep into how, quote, major companies acted wildly irresponsibly, end quote, quote again, skirted any meaningful consequences and avoided public scrutiny, end quote. He talked about the role of 3 drug distribution companies, Cardinal Health, McKesson, and AmerisourceBergen, who were supposed to alert authorities of suspicious orders of controlled substances like opioids. For example, 3 million doses of hydrocodone were ordered by one pharmacist in a small West Virginia town of only 400 people. That's about 7,500 pills per resident. Fines were not a deterrent to egregious conduct because companies like McKesson just kept paying up to $150 million in fines. Oliver showed a 60 Minutes clip of a former DEA agent's advice: put him in jail. But then Oliver hit the nail on the head when he talked about Purdue Pharma, the manufacturer of OxyContin, which was the powerful opioid, quote, which kickstarted this crisis, end quote. Purdue, quote, aggressively marketed OxyContin to doctors as a less addictive painkiller, end quote. Oliver specifically pointed out that Purdue was privately owned by the Sackler family, whose name is on famous galleries and museums worldwide, like the Met, the Louvre in Paris. When 59 people died in one state, Purdue President Richard Sackler said, quote, this is not too bad. It could have been far worse, end quote. An absolutely callous remark from the leader of a company that recklessly killed innocent people. On a funny and freakishly futuristic note, Oliver's team asked actor Michael Keaton to play the role of Richard Sackler. Fast forward to 2021, when Keaton stars in Hulu's Dope Sick, based on Beth Macy's book, and wins multiple awards. But on a sad note, Michael K. Williams also portrayed Richard Sackler on Last Week Tonight. He tragically died of a drug-related overdose in September 2021. Rich, poor, black, white, we know that addiction transcends race, gender, socioeconomic status. It can affect you, me, and the people that we love. 2 years later, August 2021, in the midst of the COVID pandemic and filming from his home, John Oliver again devoted an episode to the public health epidemic of drug overdose, mostly driven by opioids. He pointed out that the CDC report indicating that overdose deaths increased nearly 30% in 2020. Oliver singularly focused on Purdue Pharma and specifically the Sackler family, and it was scathing, and justifiably so. Watch this.
While the details of what the Sacklers are doing are incredibly complicated, the end result is both simple and absolutely infuriating. And let's start with that deal you heard about earlier, where Purdue pled guilty to 3 felonies. It sounded like some good news, but there are some major asterisks there. Because while the company pled guilty to those charges, no individuals did, and certainly no Sacklers, and that alone is a big deal to them. In fact, just watch as Kathy jumped to remind everyone of that fact during their congressional hearing.
The Sackler family, through Purdue, has 3 felony convictions, but no one's in jail, and it has its billions still.
Excuse me, the Sackler family doesn't have a felony conviction. Purdue Pharma has a felony conviction. I'm an individual person.
Okay, hold on. I do get the point that she is making there, but the fact is, Purdue is made up of individual people who control it. Now, the company claims the bankruptcy will deliver more than $10 billion in value, but a few things about that. First, the Sacklers themselves are only contributing around $4.3 billion to that settlement, which I know does sound like a lot, until you learn the family has assets of around $11 billion, which is a massive amount of money. But I guess that is what happens when your company makes an addictive product. But people can still pursue claims against the Sacklers directly, right? Well, no, because here is the really insidious part. While there are approximately 400 civil suits that do name the Sacklers themselves, the family is insisting that they will only agree to this settlement if they get what is called a non-consensual third-party release. And this thing is bullshit. Because if they get it, all current lawsuits against the Sacklers evaporate and no future lawsuits can be filed, meaning that the Sacklers, who didn't file for personal bankruptcy themselves, remember, are basically off the hook. And if it sounds weird to you that a company can declare bankruptcy and then a bunch of individuals get shielded from liability, that's because it is. It's really fucking weird. In fact, Some bankruptcy courts don't allow these third-party releases at all, but Purdue very carefully chose one that they knew probably would. A few months before filing for bankruptcy, Purdue changed one of its official corporate addresses to one in White Plains, New York, at which it's never conducted business, and where there is only one bankruptcy judge who, completely coincidentally, has supported third-party releases in the past, which is all a pretty obvious tactic, isn't it?
Shocking and repulsive, isn't it? Detail by detail, Oliver breaks down the deliberate maneuvers by the Sackler family to avoid any accountability, any responsibility for their actions in creating this current health crisis.
I would argue that when your family's company recklessly sold a product as damaging as OxyContin, the question might not be how many billions is it right for you to pay, it's how many billions is it right for you to keep? And I would argue no billions. And I'm afraid it somehow gets one step worse. Because the way this settlement is structured, it's actually hurting the Sacklers even less than you might think. That $4.3 billion that they've agreed to pay is spread out over 9 years, with the largest payments coming toward the end of that period, which means they could make that money up in interest and investments and never have to touch the principal. In fact, when the Sacklers are done paying in 2030, they will probably be richer than they are today. Unfortunately, when it comes to accountability for the Sacklers, this is probably it. Because while technically they could still be criminally charged, nobody expects that to happen. And it is just infuriating that things are set to end so comfortably for a family that has made so much at the expense of so many.
Yes, John, it is infuriating. As a doctor, I don't know the legal details, but I can tell you the countless stories of people, including my patients that I've cared for, who've cried in my clinic, riddled with shame and guilt because their lives now revolve around substances like oxycodone and Percocet and Vicodin and heroin, and as well as other highly addictive drugs such as benzodiazepines and alcohol in order to ease their pain and suffering. The individual members of the Sackler family need to be held accountable for the trauma they have caused to millions of people. But John Oliver doesn't just talk about opioids. He has an understanding of addiction as a chronic illness, which he discussed in a highly critical expose of rehab facilities.
There is now a broader understanding that addiction is complex and that nothing about getting off alcohol or drugs is easy. Experts now view addiction as a medical problem, often likened to a disease or a chronic condition, and a common way of treating it is through stints in rehab. It is a $35 billion industry with over 14,000 rehab facilities across the United States, some of which have fancy names like Promises or Passages or Milestones. You know, names that sound like perfumes worn exclusively by widows. A report a few years ago found that the vast majority of people in need of addiction treatment do not receive anything that approximates evidence-based care. Cliffside, the place from the ad that you saw earlier. Now, a month of treatment there costs tens of thousands of dollars, and its founder, Richard Tate, gets a little defensive when asked if it's worth that price.
Listen, $73,000 sounds like a lot of money, but if you go to the Four Seasons for 30 days, okay, that's gonna be 40 grand.
Right.
Okay, what did you get? Was there any life-changing thing going on there? Everything that we've done here is mindful. It only seems like horseshit to people that don't know better. But you don't have to know better, bro, because your life didn't depend on it. You didn't go through it.
Okay, calm down, bro. Besides, you're being a little unfair to the Four Seasons.
What John discussed is absolutely true. While some rehab facilities provide compassionate, evidence-based care, the vast majority do not. They have no oversight, all while charging massive amounts of money. Talk about exploiting people struggling with addiction, as well as their desperate family members during their most vulnerable moments. But perhaps Oliver's most poignant episode was in March of this year about harm reduction, a concept that is still poorly understood both among the medical community and the general public. He again reminded viewers that deaths related to drug overdose were reaching alarming levels. Over 100,000 in 2021, as I mentioned before, 3 times that of traffic accidents and twice that of gun-related violence, and mostly driven by the potent opioid fentanyl, which was widely contaminating the drug supply. He astutely described the United States' archaic, unsuccessful, and racially driven war on drugs, which led to mandatory minimums, mass incarceration, and mass hysteria. John recognized that people are actively dying and we need to keep them alive using any and all strategies that work. And harm reduction is one of those underutilized strategies.
Harm reduction accepts the reality that people will use illegal drugs and that some either can't or don't want to stop. So rather than arrest them, we might be better off trying to mitigate the damage done. It's a concept that you might already be familiar with through things like syringe services programs, which give people clean needles and are proven to massively help drive down the spread of disease. And right now, if you genuinely want to reduce the number of overdoses, there are some important tactics that we could encourage. First, there is drug checking, the simple act of testing drugs to find out what is in them. This can be done through things like fentanyl testing strips or reagent test kits. These are very valuable tools to keep people safe, and yet, thanks to those drug war era laws on paraphernalia that I just mentioned earlier, they're technically illegal in all of these states, making it a liability to carry them, which is just complete madness. Now, thankfully, some states have written carve-outs for specific methods like fentanyl testing strips, and others are choosing not to enforce their stupid laws criminalising them. The problem is, though, police officers may not be aware or indeed care about those carve-outs and are still very much arresting people or using the presence of testing equipment as probable cause for further searches. And all of this means people are still getting locked up because they were carrying a life-saving tool, which is ridiculous.
Side note, John, the Heimlich maneuver, i.e. abdominal thrusts, is life-saving. And if, God forbid, should you be choking, then I will try to save you, unless you don't want to be saved. Oliver went on to describe other science-based harm reduction tools such as naloxone, aka nasal Narcan, which can reverse a potential fatal overdose. But note, reversing the overdose is just step 1. That individual who just overdosed needs immediate medical attention. They need to be offered long-term treatment, including medications and counseling or therapy. Remember, addiction or substance use disorder is a chronic disease of the brain, and like all chronic conditions, it requires long-term treatment. If somebody has a heart attack, you don't just give them a baby aspirin and say, sayonara. They're taken to the hospital, they undergo cardiac catheterization or open heart surgery. They're placed on numerous medications to control their blood pressure and cholesterol. They're possibly referred to a nutritionist or cardiac rehab and followed by a cardiologist. But do you think any similar life-saving measures are applied or offered to people with addiction? According to the National Institute on Drug Abuse, or NIDA, among the 21 million Americans with a substance use disorder, only about 13% receive any treatment. Harm reduction tools can improve the quality of life as well as keep people alive to get them into treatment. Examples can include clean syringes, naloxone, condoms, food, clothing, legal and health services, as well as safer injection sites or safer consumption sites, also known as overdose prevention sites, or OPCs. Vancouver's Insight was North America's first OPC. As of January 2021, Canada now has over 30 OPCs. New York City's first OPC, On Point NYC, opened in November 2021. In episode 40, I featured Executive Director Sam Rivera, as well as Housing Works harm reduction expert Max Sepulveda. The reality is that people with alcohol and drug addiction are highly stigmatized. They are still judged and shamed. In addition, the public and most medical professionals have a poor understanding of addiction as a chronic but treatable and preventable health disorder. I'll be honest, I learned very little about pain management and even less about addiction during my own medical training. Same applies to nearly every practicing physician today, as well as nurses and nurse practitioners and physician assistants. I am, however, optimistic as more and more students and trainees in professional health schools are learning about addiction. But we also need the help of other sectors, including powerful ones like the entertainment industry, to tell stories that are rooted in science and compassion, not stigma and misinformation. So, for all the reasons I just discussed, I applaud Mr. John Oliver and his award-winning team at Last Week Tonight with John Oliver for consistently and compassionately talking about this important and often misunderstood health problem. As you can see, John, I have multiple degrees and I would be behind me and I would be happy to give you one of them. But please note that you probably won't be able to prescribe any meds or perform any physical exams or essentially practice medicine of any kind. But you can do the Heimlich maneuver if someone's choking. So, for all of you watching out there, how can you get involved? Learn more about addiction and harm reduction, donate to or volunteer with trusted sources like the American Society of Addiction Medicine, or ASAM, the American Association of Addiction Psychiatry, NIDA, the Partnership to End Addiction, Shatterproof, SAMHSA, the Global Commission on Drug Policy, Harm Reduction International, Drug Policy Alliance, and many more. Well, that's all for today. Here's your joke of the day, medical theme. Did you hear the joke about the highly contagious bacteria? Never mind, I don't want to spread it around. Well, that's all for today, folks. Subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well, and I'll see you soon.